Hello everyone, welcome to my YouTube channel. Today we'll see the cranial nerves. Means our body is having the 12 pairs of cranial nerves which are very helpful to transmit the informations are in nerve signals. Here the 12 nerves are olfactory nerve, optic nerve, oculomotor nerve, trochlear, trigeminal, abducens, facial nerve, vestibulocochlear nerve, glossopharyngeal, vagus nerve, accessory nerve and then hypoglossal nerve. So these are the 12 pairs of cranial nerve. Next we'll see the functions of these nerves. Here the first nerve is olfactory nerve. The function of olfactory nerve is sense of smell. Means this nerve is helps for the detection of the smell. And next nerve is optic nerve. Optic nerve, the function of this optic nerve is sense of sight. Sight is nothing but a vision. Means optic nerve is helps for the vision. And next nerve is oculomotor. The functions of this oculomotor is extraocular eye movements. Oculomotor means it helps for the extraocular eye movements, lid elevation, pupil contraction and the lens shapes. Lid elevation is nothing but an eyelids, elevation of the eyelids. And next nerve is trochlear. Trochlear nerve, it helps for the downward and inward movements of the eye. It helps for downward and inward movements of eye. And next nerve is trigeminal nerve. It helps for the mastication, sense of touch, pain and temperature. Mastication is nothing but a chewing of foods. Means this nerve is helps for the mastications. And abducens. The function of abducens nerve is eyeball movements. And next nerve is facial nerve. The facial nerve itself, the word itself suggests that it helps for the facial expressions, lip articulation, taste on anterior tongue and also helps for the secretion of saliva and tears. So this is the main function of facial nerve. And next we'll see the vestibulocochlear nerve is hearing equilibrium. It means it maintains the normal sounds, means the normal mechanisms while the hearing. And next nerve is glossopharyngeal. Glossopharyngeal nerves, it helps for the taste and the posterior tongue. The function of glossopharyngeal is taste and posterior tongue, gag reflex and swallowing. Means here the facial nerve is helps for the anterior tongue and the glossopharyngeal nerve, it helps for the taste and the posterior tongue. It may come in the multiple choice questions. And also it helps for the gag reflexes. Means it prevents the entry of foreign substances through the throat and also it maintains the swallowing. And the next nerve is vagus. Vagus nerve, it helps for the visceral muscle movements. Visceral muscles means these are the smooth muscles which are present in the visceral organs. Those are heart, lungs and intestine. Okay, means the vagus nerve, it helps for the visceral muscle movements. Vagus nerve, it helps for the visceral muscle movements. These muscles are smooth muscles which are present inside the inner lining of visceral organs. So here the visceral organs are heart, lungs and intestine. Next nerve is accessory nerve. The function of this accessory nerve is trapezium and sternocleidomastoid movements. Means these muscles which are present in the neck and in a shoulder. Means the accessory nerve, it helps for the movement of the neck and in a shoulder. And the last nerve is hypoglossal. Hypoglossal nerve. The function of hypoglossal nerve is speech movements of the tongue and swallowing. For your easy remembrance, I want to make one formula, an easy formula, that is O3 T square of Vaga and Va. So don't forget this formula. If you remember this formula, easily you can write the 12 pairs of the cranial nerves. That is O3 T square of Vaga and Va. And also you can remember the functions of these nerves. That is sensory, motor, mixed sensory, motor. That is sensory, motor, motor, mixed sensory, mixed, and motor. Means in the mixed, it will do both the sensory as well as the motor functions. So this is the functions and in brief introduction about the cranial nerves.